with various COVID-related solutions. And again, they're not all unique and they don't all meet the criteria, so we can't support them. But it certainly has created an urgency for those solutions to be considered and developed.
What, if anything, has changed from your perspective as a result of COVID, whether it's access or whether it's a technological focus? Have you seen any significant changes that you'd like to share with our audience during the COVID time versus prior to COVID in the VA system?
Well, like any medical system, it certainly has become much more disciplined and much more focused on all of the additional protocols that are required, to manage a pandemic. So that's not unusual. Yet there have been some psychosocial costs that are across the system. We are seeing veterans that are suffering from more depression, are needing more attention, which is why the Secretary has veteran suicide prevention as one of the top priorities for the year. We've also seen an increase in the effectiveness of telehealth. So a lot of telehealth is now being deployed outside the walls of the hospital. I'm seeing a lot of companies that are approaching us with various COVID-related solutions. And again, they're not all unique and they don't all meet the criteria, so we can't support them. But it certainly has created an urgency for those solutions to be considered and developed. We addressed unique salient characteristics. We must be able to support the government's mandate to make legal and ethical decisions for solutions that support the high-level strategies of the system.
Are there any characteristics you think about doing business with the VA that are dramatically different from doing healthcare business in the private sector? What can you share with us about that?
That's a great question. And let's come back to the movement toward outcome-based care. In the private healthcare systems, that's really tied to economics, right? We must be able to deliver high-level care so that we are remunerated at the highest level we can, from the insurance companies or from Medicare, Medicaid. Just treat somebody inadvertently or with multiple codes that we can charge for. We need to make sure that they're getting well, that they are recovering well. So that's an economic driver in a private healthcare system. In the VA, it's no different. I mean, we call that proof of stewardship. We need to be able to make sure that we're good stewards of the government's funds in terms of taking care of a veteran. But at the VA, there's also a strong ethic. There's a strong commitment to the veteran, much like you feel, Brad, from your family.